The story of Embrace began in 2009 when our founder Lauren O'Brien had just healed from an orthopedic injury. She found herself searching for a place where she could donate her crutches and medical equipment that had helped her recover. But she wanted to make sure the equipment went to someone in need at no cost. Lauren knew there were many low-income, uninsured patients that would benefit tremendously from the availability of reused medical equipment. And that's why she started Embrace. Our mission is to increase mobility for individuals in need and significantly improve people's lives by providing them with medical equipment that otherwise would be discarded. The more equipment we collect, the more people we can help, and that's why we need to increase our collection sites as well as our distribution channels. Embrace has built a strong partnership with some of the largest orthopedic practices, which let us collect equipment. At the same time, our affiliation with other organizations has helped us recruit more than 400 volunteers per year to support our day-to-day operation. We also build strong relationships with hospitals, nonprofit clinics, and other organizations that serve as channels of distribution. They help us to get more equipment in the hands of those in need. Our initial efforts focus on implementing an inventory system. Every piece of equipment we collect is assigned a barcode that allows us to track all kinds of data, like where the equipment came from, its value, where it went, who did it help, even if it was ever donated back to us afterward. The system not only makes our operations unique, but also very efficient. We measure success by the amount of equipment collected and distributed, and the number of individuals served. Our goal is to distribute 5,000 pieces of medical equipment annually, meaning we have touched the lives of at least 3,500 individuals. When we match a piece of equipment with an individual in need, that immediately translates into increased mobility. And since our work costs an average of $100 per piece of equipment, we also create a savings of $500,000 in healthcare costs every year. Embrace was founded with the purpose of providing equipment to those in need at no cost. Our application process is quick and simple. We provide orthopedic equipment to anyone in need for free as long as the equipment is available. We also collect used prosthetic legs that we later disassemble. Then we work with prosthetic specialists to build new prosthetic legs for people in need. This program is also unique to our organization, and we do it at no charge. Even though Embrace is a young organization, we have already had more than 60 collection sites. We collect on average 5,000 pieces of equipment a year. We have shipped equipment to more than 12 different countries. We have helped an average of 3,500 people a year, and all these under very limited funds. Our organization is very efficient by design. Securing funding for our operations has always been a challenge. And our policy is not to use the equipment that we collect for financial gain, even though it's highly valued. We're committed to provide this medical equipment for free to individuals in need, so that forces us to look for funding in other ways. Some people also see us as a very young organization, and therefore are hesitant to provide significant financial support. But we're working to overcome this funding challenge by creating a handful of annual fundraising events. The need that we address is not only local, but also national. Our program is scalable, and we could have a larger impact by growing geographically. With additional resources, we would reinforce our current operations in Atlanta first, and then expand to a medical program to other cities in the United States. Providing a prosthetic leg is just the first step of improving the quality of someone's life after they have lost a leg. Usually, after getting a prosthetic, there are many other tasks to take on, like learning to walk again, physical therapy, and in some cases, mental therapy. Currently, Embrace's program only covers that first step of the process, building the prosthetic. With additional resources, we could help patients from beginning to end.